A tummy tuck or an abdominoplasty is essentially removing excess laxity in the abdomen, in the skin, and also in the muscle fascia. So we tighten the muscles, which helps to narrow the waist. We remove the extra skin that usually has stretch marks in it, and then there's some sort of lipo-contouring around the waistline as well. The key elements to a tummy tuck is making sure that the patient has enough extra skin in the upper abdomen to resurface the entire abdomen. That way you can get all of the skin out from below the belly button, and that's usually where most of the stretch marks are located, and then also tightening the abdominal wall musculature. Incision placement with an abdominoplasty is very important because the last thing you want is to have the incision so high that it can be seen if you're wearing a bikini bottom. So I like to do my incision essentially horizontally. As you approach the groin crease, it will have to parallel the groin crease so it looks a little bit more like a smiley face. When I first started doing abdominoplasties, I tried to always keep the incision as short as possible, and what I was noticing is that there was more of a gathered appearance to the incision, and also at the end of the incisions was a little dog ear of extra skin. So it's always better to slowly taper the removal of skin so that it comes nice and tight along the sides, and that way you get a much better contour and also a flatter, smoother abdomen. Overall, the incision may be a little bit longer, but no one complains about the length of their incision, but they would definitely complain about an irregular scar or a dog ear. I don't know if you've ever looked online at some tummy tucks. You sometimes see a big scar like this big around for belly buttons. Well, I've perfected the umbilicoplasty. Essentially, I like to make it an innie where you're suturing deep inside and imbricating the edges of the scar so it can hardly be seen by the naked eye. The best candidate for a tummy tuck is essentially someone who is done having kids and has already gotten back down to what they would consider to be their ideal body weight, or at least within maybe 20 pounds of their ideal body weight. That way we get the best possible outcome. When selecting a plastic surgeon to do your tummy tuck, you want to make sure that he's board certified, and also that he's done hundreds and hundreds of tummy tucks and has a lot of experience perfecting the art. After a tummy tuck, patients feel so elated that their abdomen looks potentially even better than it did before they even had kids. Nice and tight, and they just feel like they could wear anything, fit into clothes, and it's just a life changer.